I'm Skylee Edmiston. I'm the Osteology Team Lead with the Aveda Institute in Tucson. I will be guiding you through the most updated State Board Practical Examination as of June 2015. When going to your practical examination, there are a few things you'll want to keep in mind. First is your attire. You are going to want to be wearing all black as it is less conspicuous. You need to look professional. You must have closed-toed shoes, no jewelry, no nail polish, no fingernails, fake nails, nothing dangling off of your ears or your neck. You also want to make sure your hair is pulled up and out of the way. If you wear glasses and they're unable to stay put when you're bending over, I recommend wearing contact lenses just so that you're not constantly touching them. As far as your attire for your smock, it should be all black so that, like I said, you're less conspicuous. You also want to make sure it zips or buttons in the front. It is comfortable but not too big to where it would be dragging or hanging anywhere, and it does need to have sleeves as well. As far as your kit goes, you will want to have some type of rolling bag or duffel bag. If you do have a bag with your school's logo on it, you do need to mark that out, as it would be a conflict to be showing what school you're from. As far as your rolling bag goes, inside of your bag you should have a box that is labeled sanitary. It's going to contain all of your supplies. This would be the box, and then you're also going to have your mannequin head, your clamp. I recommend on the outside of the bag, if you have a zipper pocket, to keep your citrus and your hand sanitizer in. That way you're able to get to that first to be able to clean off your table. As far as trash bags, you do need to have 3 separate trash cans. They do all need to be lined, and they need to be labeled soiled linens, to be disinfected, and trash. Other than that, you won't need any other additional supplies. The first section will be your work area and client setup. You will need to set up your guest for the services you're performing, as well as all of the universal and general supplies you'll need for the first few steps of the examination. This includes the cleansing of the face with product, exfoliating the face with a facial brush, including towel steaming of the face, and massaging the face with product as well. So you will set up all of those at the same time. They will all remain on the table throughout the first part of the examination. For your first step, you're going to take out your citrus, and you can use either a towel or paper towel. I recommend paper towels, they're much easier to dispose of. You'll spray the towel, not the table. Wipe down your area. You have about 4 feet for your examination table, and it should be a little bit deeper than the table I'm using, so you should have plenty of room. You're going to want to leave your citrus where they can see the label. Then make sure your trash cans are set up so they can see them. If you are using a paper towel, you'll just throw it in the trash. If you are using an actual towel, you'll need to put it in the soiled linens container. They are very strict on what goes into which bin, so you will need to make sure you read through the bulletin so you clearly understand where things go. Then you'll grab your hand sanitizer. Sanitize your hands. Then you can go in your bag. You'll get out your mannequin and your clamp. At this point, I recommend taking the box out of your duffel bag, zipping it back up completely, and getting it out of the way as far as possible. And then you can always sanitize again. You can never sanitize too much. You're going to grab the first 2 bags. I have them separated in 2. If you want to separate them into different bags, you're more than welcome to. It's just up to preference. First thing you're going to do is get your clamp set up. You want to make sure it's on there pretty tight so it doesn't come flying off. I like to get out my setup supplies first. And go away. First thing you're going to have is your headband. I would put the headband on before you put the mannequin on the stand. That way it helps to keep it in place and it doesn't fly off. Then you'll want, I'll have to grab another one of those out of my kit. You'll want something to wipe your hands on. have your Sanex strip. Drape. You do have 15 minutes for this section, so don't feel like you have to be in a crazy rush. You should be able to finish it, no problem. I like to fold this in. You don't need a ton of area to cover the guest. Make sure your headband is in the proper spot. You want to have enough forehead showing. But you want to try to cover the ears, and then just make sure that you have anchored down your mannequin head so that it doesn't slide around. Whoop! And if that happens, you'll just go ahead and pick it up. According to state board, supplies like this don't need to be re-sanitized if they fall. Same with the mannequin head. If it falls on the floor, you just pick it back up and keep working. You will want to sanitize your hands, of course. Then you'll grab the rest of your supplies. You'll need a facial brush. You can use a simulated brush if you like, but they're very inexpensive at Sally's, and I just recommend using the real thing. You'll also need your blood spill bag, which will have a biohazard label, and then it does need to have Band-Aids, alcohol, and gloves in it. You'll have your eye makeup remover, your toner, your water, your cleanser. You'll need massage cream for one of the steps, and you will need exfoliant for one of the steps. You'll also need a hot steam towel for the exfoliation step, and then any little cellulose sponges to remove cleanser, massage cream, etc. And then some cotton rounds to tone with and to remove the eye makeup as well. And then you just want to get your bags out of the way. I do recommend folding them. And if you can, tying them into a knot. It just makes them smaller when you put them in the trash can. If your trash overflows, you will get marked off. So you want to keep it as much as you can in the trash can. Sanitize your hands, and then step back. The first step you will perform is cleansing the face with product. You will have 10 minutes to complete this section, and they will inform you when you have 8 minutes remaining. First thing you'll do, step up to the table and sanitize your hands. Then you're going to take 2 cotton rounds. You're going to apply the makeup remover to the cotton rounds. You're going to apply them to the eyes. I recommend doing one at a time just in case they don't catch the first one. You're going to want to swipe down and out and then go out across the eyebrow. They'll go in the trash. Then you're going to take another one. Makeup remover again. Hold the lips tight and smooth it across, removing any lipstick. Then you're going to take your cleanser. You want to make sure you use enough cleanser, that doesn't look like you're dragging or pulling, and you want to make sure that your nozzle does not touch the skin. Apply your cleanser evenly all over the face. It's okay if you get some on the headband, that's what it's there for. And there is no set movements that you need to do for cleansing. You just want to demonstrate that you have gently removed makeup from the face without dragging or pulling the skin, and without getting it into the mouth, the nose, or the eyes. And I always say a little bit more is better than a little bit less. If it looks like you are dragging or pulling or there's no product on the skin, they will mark you off for this step. You can use your towel to wipe off your hands. And then eye remove with cellulose sponges. It's just quicker, easier, and much cleaner. Whoop. Just trying to run away. And when you're cleansing, just make sure you're always using the up and out movements. You don't want to look like you're trying to pull their skin down towards their neck. And make sure that you do remove all product. If you do happen to get some in the nose, just make sure you get it out. Check under the chin. And then these will go into soiled linens. Then you're going to tone the face. Now for the updated exam, you will not be taking anything off the table when you're finished with each step. You'll just want to set things aside. In the real world, you would never actually throw away a product container after using it on a guest, so that's what they want you to be simulating during state board, is a little bit more of real life situations. So you'll just set them off to the side. When you break down after your last step for the first client, that's when you'll go ahead and take them off the table. You will now perform exfoliating the face using a facial brush and steam toweling the face. You will have 10 minutes for this section as well, and you'll be informed when you have 8 minutes remaining. First thing you're going to do is take your exfoliant product. Well, I'm lying. The first thing you're going to do, sanitize your hands, as always. Then you're going to take the exfoliant. Apply it generously over the face. Wipe off your hands if you need to. Now I recommend when you use the facial brush, I would wet it before using it, just because if you don't, you're just going to absorb all the product you just put onto their face in the brush, and it may look like you are using a dry brush and no product on the face. Then you're just going to do gentle up and out circular movements, avoiding the eyes and the mouth and the nasal passages. Make sure you cover the whole face. Make sure you get the nose or above the lip as well, and then under the chin as well. Then this is going to go in the to be disinfected container. You're going to take your steam towel, bring it out if you need to in the bag, check it for temperature. Apply it to the face. Just hold it there for a second. And then I will use this to actually remove the product rather than having to use an extra set of sponges or anything else to remove. Just make sure that you are getting all of the product off when you go to remove. You can make yourself a little mitt if you need to. This will go in the the soiled linen container. And then make sure you throw away your bags. Sanitize your hands. And step back. You will now perform massaging the face with product. You will have 10 minutes to complete this section again, and you'll be informed when you have 8 minutes remaining. Step up first, sanitize your hands. Take your massage product. Make sure you are being liberal with it. You want to make sure you have enough. And then I recommend you need to do 4 movements. You must do petrissage, effleurage, tapotement, and friction. And the examiner must see you perform all of these. In order to accomplish that, I would do them in sections 3 separate times. So you could start with, say, doing a little bit of this. You can do some effleurage. Friction. Whatever movements you choose, just make sure you do them in the same order 3 times. So you'll go back down, do some petrissage, do some effleurage again, do some tapotement again, friction once again. And you'll just repeat this 3 times. That way you ensure that the examiner has seen all of the steps. Once you're finished that, you can wipe your hands. You'll take your cellulose sponges. Just make sure you've removed all product, put those in the soiled linens, sanitize your hands, and step back. Once you've completed the 3rd step on the first guest, you will have 5 minutes to break down your supplies. The only thing you're doing at this point is taking off the drape from your guest, putting it in the soiled linens, taking off the Sanex strip and putting it in the trash, taking the headband off of the guest, taking the towel. You'll want to lift your guest off the table, put these into the soiled linens, take off the product you used previously. You can leave your toner and your water. Everything else will need to go into the to be disinfected container. And then at this point, that's all you're going to do. You'll leave everything until you start setting up again and you're instructed to set up for the next client. You will now set up the supplies needed for the 2nd guest, as well as the general universal supplies you'll use for the rest of the examination. First thing you're going to do is step up and sanitize your hands. You'll go in and get your 2nd paper towel or towel for cleaning the table. Spray the paper towel. You're going to want to pick things up off the table, wipe the table down. You can wipe down the things on the table as well. And then put this into your soiled linens if it is a towel, or to your trash if it is a paper towel. Then what you're going to go ahead and do is sanitize your hands again. Go into your box and get the last 2 sets of bags you will need for supplies. I like to sanitize again just in case. Take your first bag. It should be identical to the first bag from the first section. So you will have your headband, which we're going to put on this way. You'll have your Sanex strip. Your towel for wiping your hands. And another drape. You will need to use clean supplies for the 2nd guest. You cannot reuse the first set of supplies. Set your mannequin down. Make sure that they're nice and tight. Then you have quite a lot of supplies for this 2nd set, so I highly suggest you organize them in a manner that you're able to find everything for each step. So you've got quite a lot of things here. We're going to go ahead and separate our waxing supplies, and Microderm supplies. I have an extra toner and water, so we'll go ahead and just put those to be disinfected. We don't need those right now. Mask supplies, make sure that you have everything you need. If for some reason you forgot something, try to have an extras bag so that you can go into it and get whatever it is. about 4 feet for table space, so you should have plenty of room to be able to set everything up. Just make sure you don't put anything where you might accidentally knock it onto the floor. If it's a disposable supply, you'll have to go in and get a new one out of your bag, and that's just a pain. Then sanitize your hands and step back. The first step in the second guest will be hair removal of the eyebrow, which was 1 eyebrow tweezing and 1 eyebrow using soft wax. For this section, it is not timed because you will be individually instructed by the examiner when to perform each step and which one to perform. So let's just assume the first thing they ask you to perform is tweezing. We'll step up and sanitize. At this point, you don't have to sanitize because you're going to put gloves on, so the gloves will protect your guest from anything that may be on your hands. I just get used to sanitizing and do it all the time. It does make it a little bit more difficult to put gloves on when your hands are sanitized, so just keep that in mind. Okay, first thing we're going to do is take our antiseptic, clean the brow, take our tweezers, hold the eyebrow tight. You want to be exaggerated since there isn't any skin here for you to hold. You want to make sure that they see that you are holding tight, and then you want to pull from the direction the hair grows. You can do it a couple times. If they're staring at you, you really only need to do it once. Then you're going to take your tweezers. They don't need to be back in the container, but they do need to go in the should be disinfected container. You're going to take another cotton round, antiseptic again, and clean off that brow. Then you'll step back. If they ask you to perform the second step right away, you would just step right back up. Otherwise, you'll wait for them to come around and tell you to do the waxing step. So at this point, let's assume that we're doing waxing. You will want to sanitize at this point. You don't need to take your gloves off in between each step, but you will need to sanitize. First thing you're going to do is take a cotton round, antiseptic. Make sure you use the opposite eyebrow that you tweezed. Then you want to make sure that you dry off the brow because you can't put wax on a wet person. Take one of your sticks, take some soft wax, apply it to your arm, grab one of your strips, apply that, and remove. Make sure if you drop any supplies, you pick them up right away. If they stay on the floor, it is considered an unsanitary work area. You will be marked off, and then make sure you sanitize your hands. Now we can go ahead and take our soft wax, apply it to our guest. Because they do have to have eyebrows now, you want to make sure that you are applying it so that it is not on the eyebrow. You're just going below the brow or above the brow. And it's very hard to get this wax even, but you want to try as hard as you can. Take your strip. You're allowed to rub it back and forth. That is acceptable now. And hold tight, pull, apply pressure. Then you're going to take a cotton round. I use the post wax first. Remove any residue. Then you're going to want to use the antiseptic again. Clean off the brow. Take off your gloves and step back. Next step will be particle microdermabrasion on the forehead. First thing you'll do, sanitize your hands. For this step, you will need to cover the guest's eyes as well as your own eyes. I won't be covering mine today, but during your examination you have two options. You can either wear safety goggles, or if you already wear eyeglasses and you're going to wear them to the examination, that will count for safety glasses. So once we've sanitized, I like to put my gloves on right away. Put your guest's eye protection on. I recommend just making a butterfly pad. If it is long enough to tuck into the headband, even better. That way you don't have to worry about it going anywhere. Make sure you still have some forehead exposed. Then go ahead and apply the mouth protection. I'm not going to wear it just so you're able to hear me better, but you would need to wear something that covers your entire mouth throughout this portion of the examination. Then just sanitize again if you've touched your hair, you put the eyeglasses or the mask on. First thing you're going to do is take prep solution or a degreaser, apply it to the forehead. You want to dry it. Then for your microdermabrasion cord, originally we used this cord. It is a little bit too cumbersome, and now knowing that you need something that can uncoil freely, I recommend even just getting a pencil with a string on it. We actually purchased this from Home Depot, and it's plumbing equipment. It looks nicer, but it doesn't work as well. What you want to do is keep it out of the way. It can't be wrapped around your shoulder. It could be wrapped over your arm like this, but that's it. You also need to make sure that you're showing, that you're doing vertical and horizontal motions. With this cord, it does need to be 4 feet long, so that is pretty long. Just want to make sure you keep it out of the way. You don't want to smack you or your guests with it. What you'll do is exaggerate that you're holding the skin tight. Whichever way you're holding is how you're going to show the vertical or the strokes, and then you're going to switch your hand, show it the other way. You want to work your way across the entire forehead, just showing them that you are holding tight, working across the forehead. The easiest way that I say to do it is just imagine you're making a hashtag. Everyone should know what those are at this point. Then you can take this tip, put it in the to-be disinfected container, take another cotton round, and swipe the imaginary particles off the guest's face. Take off their iPad, and take off your glasses, eye protection, your mouth guard. If you're using glasses that are just safety goggles, you'll want to put them in the to-be disinfected container. Otherwise, everything can go into the trash. You can always push the trash down with your foot, but don't ever use your hands. Sanitize your hands and step back. You will now perform the facial mask step of this examination, as well as conclude the facial by moisturizing the guest. Step up and sanitize your hands. You're going to you need a portion cup or some other type of plastic cup, and a stick. You will dispense mask product from the original container into a portion cup. Throw away the stick. Make sure you close your mask product. Take a brush. You can use any type of brush you want. Fan brushes work really well as well. You want your mask product to be colored. It cannot be clear because they do need to be able to see it. Just to make sure you're trying to apply it as evenly as possible to the guest's skin without getting it in the mouth, the nose passages, or the eyes. You can put it over the eyebrows, that's okay. If it gets onto the headband, that's fine as well, that's what it's for. You also want to make sure that you're going underneath the guest's chin and getting it down under there. If you do get it on the nose, just make sure that you remove it when you take the mask off. Okay, then you're going to throw your portion cup into the trash. Your brush will go in to be disinfected. You'll go ahead and get your cellulose sponges and just make sure that the examiner has actually seen the mask on your guest before you remove it. If you need to, you can have extras of these in your kit because sometimes it does take a little bit to get off this product, and you want to make sure that you are fully removing it, because if not, you will get marked off. And you do have 10 minutes for this section, so you don't have to worry about working really fast. You have the time to take. If you need to, pull back the headband a little bit, just make sure you got it all off the face. Also come down and check under here, make sure you got it all under the chin. These will go in soiled linens. If you need to, you can wipe your hands on your towel. Then you're going to tone the skin. Throw those in the trash. You're going to moisturize the guest as well. You don't need a lot, just keep in mind you're going to be doing makeup right after this, so less is more. They don't need to see that you've got a ton of moisturizer on the skin. You just need to make sure that it doesn't look like you're dragging or pulling when you're putting this on. You can wipe your hands if you need to. I like to organize my things just to make sure that they look neat and clean. Get rid of any extra things you don't need. Sanitize your hands and step back. You will now perform the facial makeup step of this examination. You will have 20 minutes to complete this section, and they'll inform you when you have 10 minutes remaining. The main thing they're looking for is sanitation and safety. So you have two choices. I like to put the makeup into little containers and label them. If they're in the original packaging, you can use that packaging. Just keep in mind, if it is a brand specific to the school you go to, like Aveda, you will not be able to use it. So something like this Aveda mascara would not be okay for State Board because they cannot know what school you come from. If it's Maybelline or L'Oreal, that's fine. First thing you're going to go ahead and do is dispense your product from this container into your palette. You will be working directly from the palette. You cannot apply from this container to the guest. It's not sanitary. For liquids, you'll want to use a stick to get them out. For powders, you can just tap them into the palette. I recommend, if you can, using a foundation and powder that are as colorless as possible because most of the mannequins are pretty light. Almay makes a really nice foundation that actually goes on clear and it adjusts to the skin tone, and it still works even with the mannequins. I'm not sure how, but it does. As far as lipstick goes, you want to dispense either off of an actual lipstick or out of a container into your palette. You can use the eyeliner and lip liner original as long as they are sharpened. I recommend just having a sharpener in case they're not sharpened. And then you'll need two mascara wands, one for the mascara, one for grooming the eyebrows. I like to use these little disposable sponges for eyeshadow. You could also use a Q-tip or a lip wand. And then I use a lip wand for the lipstick. I like to use these sponges for foundation, powder, and blush. It just makes it a lot easier. So first thing you're going to do is take your foundation and dot it onto the guest. And then you're going to blend it in. If you use a color, it makes it harder to blend because these mannequins tend to have a little bit off skin color. And you want to make sure that there are no lines of demarcation. Also, with the eyebrows being drawn on, you want to make sure that it doesn't look really weird. So I like to use the lightest or the clearest shade possible. If you have like a tinted moisturizer, that works as well. As long as you put it into the proper container and label it foundation, you're fine. And make sure you get under the chin. If you need to, get up here by the headband. Just smooth it. That'll go in the trash. Then you're going to take your powder. Now, you want to make sure that you get a good base of powder on there, because if you don't, it makes it very hard to spread on the blush. So if anything, when you're working around the cheek area, just make sure you use a little extra powder to really set that foundation. That way it makes it just a bit easier to get on the blush. You do have the option of turning your mannequin head around if you need to. You won't be marked off for that. So if you needed to bring them around this way to work this way, you absolutely can. If it's easier for you, just be careful not to knock things on the floor. So we've got our powder on. Then we're going to go ahead and take our blush. You don't want too dark of a shade of blush, because if so, you're not going to be able to blend it very well. And it's already hard enough to blend these mannequins. They're not the easiest thing. You want your blush to be visible, but it doesn't need to look like a drag queen. Now, when you're working around the eyes or the lips, you have to double brace. Double bracing means using both hands. So, in order to achieve that, you have to have one hand stationary somewhere on the guest. With the other hand, you need either a pinky, a palm, or some other part of the hand always touching the guest in a stationary position. So what I do is I'll just keep my pinky down, apply the blush, or the eyeshadow. It only has to be one color. They don't require that you use multiple colors for this. And then what you can do if you have this double-ended one is just go back in and remove any extra residue that you might have actually got on the skin on accident. Throw that away. Work on the other eye, always double bracing. Then you'll take your eyeliner. Mine needs to be sharpened a little bit, so we'll sharpen that. Then double bracing again. You're going to apply your eyeliner. And it doesn't need to be a crazy thick line. You just need to work from the inside out. And you have to be double bracing. You're going to take your mascara. Make sure you use a disposable wand. And again, double bracing. Apply the mascara from the inner corner to the outer corner. Lifting up. And again on this side, inner corner to outer corner. You're not actually applying mascara. Then you're going to want to groom the brows with another mascara wand, double bracing again, up and out, working along these really awesome eyebrows. Okay. Then for lip liner, you want to make sure again that it's sharpened. So we're going to just sharpen that. You need to double brace around the mouth, so I like to use the side of my hand. It just makes it a little easier. Then you're going to apply your lipstick. I recommend trying to use shades that work together, even if you use a really light lip pencil and cover it with the lipstick. That way you don't have that line of demarcation between the two. You can apply the lipstick right over the lip liner if you need to. And it is hard to get it nice and smooth. I mean, it's mannequin, they don't have real skin. So it's a little bit different, but you want to try to do it as best as possible and just make sure that you're always double bracing. Then you can leave supplies you would not throw away, but you are going to want to take your palette and put it into the to be disinfected container. Sanitize your hands and step back. You will now perform the eyelash enhancement section of the examination. You will be given 10 minutes to complete this section and informed when you have 8 minutes remaining. You'll step up and sanitize your hands. First thing I like to do is brush foreign matter from the guest lashes. So take your mascara wand, just get rid of any foreign matter that might be hanging out on the guest's eyelashes. Throw that out. Take your lashes. And you want to measure them on the guest's eyes. Make sure they're the appropriate length, and then you need to your scissors. Okay, you're going to trim the lash on the end. You can put your scissors back in the container for now. Then you're going to take your glue. Now you don't need to put the glue on something separate because glue does not hold in bacteria. So you can just apply it to the line of the lash. You want to shake it for just a moment so that it can get a little tacky. Do not blow on it, whatever you do. And then apply it to the guest lash. Double bracing, meaning you're using both hands to apply it to the guest. Then you're going to take the second lash and do the same thing. Put it on the guest, measure it, take the scissors, trim it. Then you're going to go ahead, you can throw this away and put your scissors in the to be disinfected. Go ahead and put lash glue on. Fan it for a moment, and I would wait to throw your lash glue away just in case for some reason one of the lashes does not stick. You want to make sure that you don't get rid of something you really need. Double bracing, apply it to the lash line. Then you can go ahead and get rid of your supplies. Sanitize your hands and step back. You will now perform the blood exposure procedure. This is the last step in the examination. It is also untimed as you will be individually instructed. First thing you're going to do is step up and sanitize your hands. They're asking you to imagine the following scenario. During a service, the guest cuts their forehead. The cut is not such that you can't continue the service, but you do need to ensure that you take care of the guest's needs as well as your own and protect yourself from any blood. So first thing, take your first aid kit. It does need to be labeled as a first aid kit with the biohazard label in it. You should have a set of gloves as well as an alcohol wipe and some Band-Aids. There should also be a second bag inside of this bag. What you're going to do is put your gloves on. I like to use my heavy duty gloves for this. you're going to take your alcohol wipe. Wipe the guest cut. Put these supplies into the second bag in the blood or the first aid kit. Then you're going to take your Band-Aid. It's hard to open these with gloves on. Place the Band-Aid on the guest cut. Take everything that has come in contact with the blood and place it into the extra bag, as well as taking off your gloves and putting them in there as well. Seal up the bag. It will remain on the table as it does need to be disposed of in a blood container. Sanitize your hands and step back. This will conclude the examination as far as steps go. After this, you do need to ensure you step back. They will instruct you when you are able to step up and start cleaning up your supplies. If you start cleaning up immediately after the step, you will be marked off. So just ensure that you wait for their instruction to start breaking everything down. Once you're breaking down, you are not being graded. Just make sure that you take everything with you. You cannot use any of their trash receptacles or go in the bathroom and throw anything out. It all needs to go with you, and then you'll need to dispose of it on your own later. Thank you.